Okay. Alrighty. So, okay. So, I have already checked the patient's medical history, and now I am going to gel in and announce myself. So, knock knock. Hi.
Hi.
My name is Yi. I'm going to be a student nurse for today, and I'm going to be doing a quick physical assessment on you. Okay.
Okay.
Can you please tell me your first and last name and date of birth?
Cheerfully 10/30/89.
Okay, I'm gonna check your BAM. Okay, imaginary BAM. Alrighty. Okay, so I'm gonna close the curtain and give you some privacy. You can still see me. Okay. Um, and I'm just gonna ask you a few sets of questions. Okay. Do you know where you are?
Yes.
And where are you?
I'm in a clinic.
Okay. And do you know what brought you in? Let's just make up something.
I've been having headaches.
Oh, okay. And you have headaches right now?
Not right now.
Okay. So on a scale of 0 to 10, with 0 being no pain and 10 being the most pain, can you please, or do you have any pain right now?
Not right now.
No? Okay.
But when I do, it's like a 7/8.
A 7 or 8, okay. And can you tell me today's date?
Today is August the 12th, 2020.
Okay, and who's our current president?
Donald Trump.
Okay. So upon entering the room, I could visibly see that patient is well groomed. Patient is dressed accordingly to weather. Patient is sitting upright at a 90-degree angle with both feet to the ground. Patient's appearance, again, patient's well groomed. Patient does not look like she's in distress. There's no shortness of breath or there's no hyperventilation. Patient is alert and oriented to setting, as well as time, situation, and self. So patient's alert times 4 with a GCS of 15. So with that, I would not need to pursue the MMSE assessment. And visually look at the patient. Patient does not have any Foley lines or any oxygen lines or any IV lines, and patient has no medical device on the patient. Okay, let's see. Okay. All right. So I'm just gonna proceed on with the assessment. Can you please close your eyes for me? Okay. That's okay, and then squint. Very hard, okay? Alrighty, and then open your eyes now. And then open your mouth, please. Okay, and then smile and frown. Okay. Oh, I'm sorry. Can you open your mouth for me again, please? Okay. I'm gonna check and say okay. I'm gonna use a stick to test the gag reflex, and then there you go. Patient gagged, and then can you just swallow your saliva for me? Okay, and then stick your tongue out, and then move it left to right. Okay, so patient's facial muscle is symmetrical, and patient's tongue protrude at midline. The uvula was able to rise, was also able to rise. Patient's gum shows no inflammation, and patient's mouth was moist and showed no signs of cracks or dryness. That tells me the patient's not dehydrated. And then, okay, so I'm just going to assess your eyes, okay? So just look at me and I'm going to hold down your eyelid, okay? Alrighty. So, patient's eye sickle is not yellow, therefore patient is does not have any signs of jaundice. And then patient's conjunctiva was able to retract immediately, so that also tells me the patient is not dehydrated. And then I'm just going to quickly feel your arms, okay, and then I'm going to also feel your neck, and then your head. I'm going to be touching your head and your ear, okay. So patient's skin is warm to touch. There's no signs of, lesions behind the ear or the head. Patient's hair is evenly distributed, and there's no bumps, and patient had no discomfort in the areas that I have touched. And then can you please shrug your shoulders for me? Just shrug, okay? Just shrug, okay? And then can you move your head? Okay, try to resist, okay? This side. Alrighty, up and down. Alrighty, so patient's neck muscle and shoulder muscles are symmetrical, and patient was able to follow directions accordingly. So that tells me that patient is again alert. And now I'm going to be taking your blood pressure. Okay, so I'm going to start off with your temperature. Okay, so 37.3. So your temperature is good. And now I'm going to be taking your radial pulse. Okay, so 30 seconds, okay? Okay, so patient's radial pulse it was 64, and then I was also taking the patient's respiratory rate, and that was at 18. And now I'm going to be taking your blood pressure. Does it matter which arm I take it on?
No.
No? Okay, I'll just take it on your right arm then, okay? You're just going to feel a slight squeeze, okay? Okay, so patient's blood pressure is 108/70. Okay, and then now I am going to be inspecting your lungs. And shit, I already forgot one thing. So I'm going to be inspecting your lungs. And I'm just going to listen to your lung sound, okay? Okay, and I'm also going to listen to the back. Sorry. That's fine. Okay. So patient's lung sounds are clear. There's no signs of obstructions or wheezing. And now I'm going to listen to your heart, okay? So, there we go. Okay. So, also concerning the patient's heart, the S1 and S2 was loudest at the mitral valve and the tricuspis, and then the S2 was loudest at the aortic and the pulmonic valve. And for the Erb's point, I could hear clearly both S1 and S2. And now I'm going to percuss your pericardium, okay? I'm just going to lightly tap here and right under here, okay? Alrighty, so upon percussion, patient shows no signs of pulsation. And now I'm going to check your stomach. So can you please lay down for me?
That's lay flat.
Yeah, please. Take some time. Okay.
Like this.
Okay. Alrighty, so I'm going to start off by again listening to the patient's stomach, and I'm going to start at the lower right quadrant and work my way clockwise. Okay. Feeling okay?
Yes.
Alright. So bowel sounds are normal active, and now I'm going to palpate your abdomen. Let me know if you feel any pain or discomfort so I can stop, okay? Is that okay?
Yes.
Okay. Is that okay?
Yes.
Alrighty. Any pain there?
No.
No? What about there?
No.
No? Okay. Alright. So you can sit up now. So patient, as I was palpating the patient's stomach, there was no signs of discomfort or pain, and there was also no bumps or lesions, or any bumps or mumps. And patient's stomach was flat, and patient skin color was according to ethnicity, and it was warm to touch. And again, patient showed no signs of complaints as I was touching the patient. And then, can you please squeeze my hand? Please squeeze as hard as you can, okay? Alrighty. And then can you please point, put your toes to your nose? Okay, and then down. Okay. And then you're able to move your arm. Okay. Alright, so patient's range of motions are intact. Patient's joint and mobility shows no signs of stiffness. And here's your call light. Feel free to call me. Let me know you have any questions with anything. Okay. That completes the physical assessment. So I'm going to gel out and document my findings. Alrighty.